Last week, big pharma mainstay Merck announced a new drug. Molnupiravir was extremely effective in reducing poor outcomes for people with severe cases of COVID-19. Trials revealed it almost cut hospitalization and deaths in half. The encouraging news of the aptly named miracle drug, however, unfortunately is not the full story. According to new reporting from Matt Taibbi, a former HHS official alleges that the rollout of the drug was delayed 6 months or more after becoming collateral damage in the Trump anti-Trump culture war.
Joining us now to expand is co-host of Useful Idiots podcast and author of Hate Inc., Matt Taibbi. Matt, welcome to the show.
Thanks for having me back.
So let's talk about this miracle drug, they're calling it. By the way, I cannot pronounce this, so I'm impressed by Emily and with you.
Yeah, Ryan has a good trick.
Yeah.
What is it? What's the trick?
Molnupiravir. You just pretend you're saying my new Paul Revere, and you'll get there with it.
Oh,
and you tweak it with a little Southern accent, and you're there.
Paul Revere. Tell us, Matt, why was this, how has this drug become collateral damage? I would think in the hydroxychloroquine, ivermectin. Is that what you're referring to? That is kind of one of those?
Yeah, so what happened was this drug was originally developed as an antiviral with diseases like Ebola in mind. And some people came to the Trump administration in late 2019 before COVID broke out and brought it to some HHS officials who liked the idea but weren't completely into it. Then when February came along, the HHS people were now suddenly very interested and wanted to fund this drug. In fact, they allegedly wanted to give it the developers $100 million. But the problem was this was taking place in the middle of a massive sort of bureaucratic infighting issue between two wings of the health bureaucracy. There was it's an organization called BARDA, and technically they're bosses at HHS. And one of the head of BARDA ended up bowing out and filing a whistleblower complaint that, among other things, included accusations that this drug was being rushed because of cronyism. So as a result, this drug ended up getting shelved. There was no funding for it, and it was only luck that Merck picked it up about a month later or 2 months later, and that's why we have the drug now. But it could have been out a lot earlier.
What were the crony allegations? Like, what was? I mean, isn't all of this cronyism anyway?
Is it all of pharma cronyism?
It's very odd. If you read the whistleblower complaint, I'm reluctant to sort of mischaracterize what the doctor, whose name is Rick Bright, was saying, but essentially, the people, the doctor who he was concerned about was this person at HHS named Dr. Robert Kadlec. And he was essentially claiming that Kadlec was personal friends with some of the people who were involved with this drug. But it didn't go any further than that. There wasn't any, sort of direct accusation of personal remuneration or anything like that. It was more just sort of general what he termed cronyism, which was, and there were also other things. This was in the context of other accusations about hydroxychloroquine, about the rollout of that, about the lack of preparedness in terms of masks and N95 protective gear. So it just became part of a series of complaints.
And it lasted, right? Like, this was something that, those were conversations sort of earlier in the pandemic, but you quote someone, a former HHS official, as we read in the intro, saying this should have at least been out 6 months ago, and he adds, could have saved literally tens of thousands of lives. How much do we know about what this drug could have done had it been introduced earlier?
Well, again, all we have to go on in terms of how effective this drug is so far is what's been released by Merck in their press release, which came out last Friday. Now, they released a study that was very, very promising that showed that hospitalizations and death, are down up to 50% versus placebo. There's widespread expectation that this drug is going to get FDA approval relatively quickly. At least that's what I was told. However, it could have been, happening a lot earlier if they didn't have to go the private route. In other words, if the company that developed this drug, Ridgeback Biotherapeutics, didn't have to go searching for a larger sponsor and had been able to do this within the confines of HHS or even Operation Warp Speed, probably it would have been out possibly earlier than the vaccines itself.
So, how much do you think the culture war has to do with this in regards to these drugs not being promoted or put out there? I mean, it just seems like right now, and what's been going on for a while, as we know with these other drugs that have been demonized, such as ivermectin and hydroxychloroquine, that it's all or nothing with the vaccine. I mean, that just seems to be the discourse in the country right now. And now that we're seeing thousands upon thousands of breakthrough cases, now just anecdotally in my own life, I feel like I know more people who've had breakthrough cases than who got the virus prior to vaccination. And a lot of those people are saying, well, now that I did everything, I sheltered in place, I took the vaccine, I still have a breakthrough case, give me something. But then that something that they're maybe thinking they would like to try is demonized. I mean, how much do you think that had to do with this? Do you think it was about this sort of all or nothing discourse in the country?
Yeah, I think that played a large role in this. I mean, the whistleblower complaint, when it came out, it got an enormous amount of press coverage. 60 Minutes did a profile of the whistleblower. And this was in the context of complaints about hydroxychloroquine and chloroquine. And even in the release of this news last week, it's really interesting. If you look at the first hours after Merck did its press release, all of the coverage is sort of uniformly positive. But within a day or so, you started seeing these disclaimers stuck in the news coverage, like, yes, this is really good news, but you should take your vaccine. And then you started seeing headlines after that, what the Merck pill might mean for vaccine hesitancy and so on, right? So the idea that there might be another treatment that works is sort of automatically assumed to be like an anti-vaxxer argument, which is not true. It doesn't actually have to work that way. One can complement the other. Not everybody is immunized for various reasons, and the vaccines aren't 100% effective anyway. So it'd be nothing but good news if they had another treatment. But it's not looked at that way.
And it's 2021, and the FDA has yet to approve bleach injections as a treatment. I'm kidding.
Yes.
Don't do that.
Yes, don't do that at home. And according to reporting by The Intercept, the federal government has dropped $1.2 billion into the drug at a purchasing price of $712 per course, which is some 40 times more than it costs Merck to make it. Now, we often see that even when the government funds these drugs, they end up then overpaying for them dramatically anyway. If they had funded it, would you expect this to be different, or would we be getting gouged either way?
That's an interesting question because, then we'd have to get into how much would the government have spent on the front end, right? Like they were looking at spending $100 million up front right away, even last April. How much more would they have spent? How much would they have spent on buying whatever supplies that would have come out of that development? We've seen this before and I think it's important to note that, Tamiflu was a story that was very similar to this, right? Like there was a very promising drug that looked like it was going to have, sort of profound results on a virus. And the government immediately spent over $1 billion buying up enough doses to treat over a billion people. And that turned out to be a disaster. So in this case, you definitely have to worry about that sort of thing. But in terms of whether or not the cost would have been less if they had gone that other route last year, I think that's difficult to say. My guess is probably it would be the same.
We are so miserably bogged down by this terrible combination of red tape and cronyism, which always go together so neatly, but especially in the medical industry. And this case study, I think, illustrates very well that we can't even get into the sad state of affairs when it comes to the red tape and cronyism because we can't get past the stupid culture war conversation to begin with. We can't even deal with the red tape because we can't get there. We're still debating whether or not something that's developed under the Trump administration or something that's happening under the Trump presidency has merits versus when it's under the Biden presidency. Matt, do you think the media is becoming self-aware at all? Because you have a graphic actually in the Substack post where you show a headline under Trump, a headline under Biden, and it's just so plain. It's hard to understand how they could walk away from that and not do some introspection, but that doesn't seem to be happening. Are you hopeful that it will?
No, and again, I think there are so many articles that are dedicated to the problem of vaccine hesitancy. Why don't people go get their shot when we're telling them that absolutely this works? And none of that comes with any introspection. Like, well, maybe it's because they don't believe you, right? You know,
Right.
Maybe it's because there's a perception that the media is not consistent. When it delivers messages. Maybe it's because we make mistakes and don't own up to them. You know, I think that's the problem that I worry about. You know, especially in terms of this COVID situation, which is, you know, sort of the ultimate example of where you need people to believe the press. And they haven't, and I think that's a result of years and years and years of distrust that's accumulated because of this kind of behavior.
And I think your point that the distrust goes both ways is really important. Like right out of, as you said, right out of the gate, the coverage of this is intuitively positive. Like, hey, great, there's a therapy now that can save people's lives. That's wonderful. But then very quickly the media is like, but if we tell people that, we don't really trust them to then make the right decisions.
Yes.
So we got to quickly remind them
Noble lies.
that who knows, like, about now. But I agree with the general point, then the one that Matt made, that this is, both is good. Like, get your vaccine, and then if you get a breakthrough case, now you've got a therapy. That's also good. Mm-hmm. But people don't trust their readers and their viewers to just make that point.
Right.
Well, and we're not, and our science, our science is also seemingly not going in the direction that we need it to go in, which is try everything. Why are we not living in a society that says, look, we've got a novel virus, we've got novel therapies for this novel virus, let's try everything, let's see what works, and instead we're calling something horse dewormer or the Trump medicine, or, we're demonizing everything, and it's just very difficult to then, like I said, once people do end up with those breakthrough cases, and then they're saying, well, now what do? I don't want to take this other stuff that has been demonized in the media. I mean, it's just I think I do wonder how this is going to pan out in a couple of years.
Well, I hope the fact that Merck is the company that makes both ivermectin and Molnupiravir.
Yeah, Molnupiravir.
Well,
they don't have to
encourage people to take it seriously.
Final thoughts, Matt?
Yeah, no, I just think. I agree with all you and Ryan. I think your point is very well taken. That a lot of this is about subtext, which is interesting because as you all know, that's kind of a new consideration in the media business. Like that we used to not be in the business of worrying about what our audiences did with the information we gave them. Our job kind of ended with, let's just give you what we know, and then it's up to you to do what you want with it. In the last 5 years, there's been this radical, revolutionary change in how we do media, which is based on the idea of, let's craft the news in such a way that we know that our audiences are going to respond correctly to the message. And audiences are wise to that. They don't like it. And I think that's one of the things that the media business doesn't get, is that that the audiences understand what they're doing, and they're responding negatively to it.
Right. It wouldn't be a good thing to do, period, but it also doesn't work.
Yeah.
Right, exactly.
But Matt, thanks so much for joining us. Great reporting.
And thanks so much for having me on.
And we will have more Rising right after this.